All right. Thank you for joining us. This is Dr. Dada of Residency Success. We have Dr. Sanket with us, who is actually one of my favorites since we started Residency Success, because he was kind of one of the reasons that I was inspired to start helping other people after helping Dr. Sanket. So a little background about Dr. Sanket is that he was my medical student while I was still a resident, a neurology resident. And, you know, if you guys think that residents don't have pull or they can't change the direction of someone's life, I will attest to the fact that because he was a good student, we remained in touch. We became, in fact, friends. He asked me for guidance and direction, and I was able to do it. And I think a lot of you have heard some of my stories before. I did this for a lot of students in residency and fellowship, but then I kind of expanded it once I was done with fellowship. And now I'm a brand new attending. Dr. Sanket is in his second year now?
Yeah, second year.
Second year of internal medicine residency in Hawaii. So we're coming to you respectively from New York City, that's in my background, and Hawaii in his background. So
Definitely.
we can't even ask for better locations at this point, except with COVID, we can't go anywhere, right, Dr. Sanket?
Yeah, unfortunately, that's the case. I'm glad to be here. You know, it's a stressful process. Everyone's been through it, me, you. It's something you just have to get through it. And there's only one way to get through it, and that's like how you approach it. The strategy is key in terms of trying to get through residency. Scores, they come and go, but then, you know, interview is where you're gonna make your mark. So that's where it's at. Just want to let you know. Yeah.
Tell us, Dr. Sanket, where did you go to medical school?
So I actually went to St. George University in the Caribbean. It was really good because I got to do like 2 years there for just first 2 years, and I did rotations in like New York, New Jersey, Miami, even California. And then after that, you know, that's where I actually met her, was doing my neurology rotation in JFK. And it was just a great experience. And, you know, it's a good thing to have a mentor to guide you through, you know, each and every step of the way. And that was really what I needed. And it was really a big help. And, you know, I definitely encourage you guys to always have a mentor, no matter how early. It doesn't matter how early, but having a mentor to guide you through the process, it will make your life so much easier. Also getting your research papers and, you know, case reports, all those things are key to actually getting to that point where you can be a resident and future attendee.
Yeah, I don't know if I've ever told you this, Dr. Sanket. I always tell people, don't be a potato. I don't know if that sounds funny, but really, like, there'd be other medical students that would round with us. Either they got in the way or they were a potato, where they would be in the rotation the whole time and I wouldn't know their name. They would have no contribution. They wouldn't speak up. They wouldn't volunteer their services. I remember, you know, you were always friendly and smiling. You always said, hey, if you ever need help with anything, you let me know. And I remember being swamped because I was on night float and I always had to present. And during night float, like after 36 hours of being awake. And sometimes I would ask you to pull some articles for me or make some slides, you know, and you were always happy to do it. And that was the way you were learning. And I also sometimes would say, hey, Dr. Sanket, come up here when I was presenting, so that you got the screen time in front of the PD, you know, who later gave you a research position because, you know, not only did you show the fact that you were willing to help and jump in, and I would let you present for the first 10 minutes during, you know, one of my presentations, and then finish with the clinical aspect of whatever I was presenting.
No, absolutely.
So
I think that was like immensely like helpful and like needed in those like circumstances, and like it's really helpful. And also the other thing that I actually forgot to mention was that, you know, it was because of that Dr. Datta like actually got a research position the following year after I finished my medical school of doing like a neuro research at her place. And that was another big thing, was because of that exposure. The same thing that you were telling me is like presentations and all these things. They knew me so well that they were like more than happy to give me the position my interview process was not even long because they knew me already. So, and that becomes a big characteristic or a factor in, whenever you rotate in different places, is you got to make yourself known. If you're going to be a potato, then, nothing's going to happen to you. The potato is going to, start to die out, and you're just going to get thrown in the garbage, basically.
Yeah, exactly. It's going to get shriveled up and like sprout all these heads and then you're just going to take it and throw it out. So that's a funny thing to say, but we might coin this phrase from now on and put it on t-shirt. What do you think, Dr. Sanket?
I think that sounds like a good thing to do. For sure. Yeah. I am totally down.
So you're studying for step 3 now. You are studying at the right time because you're about to enter your final year. There are a lot of people who finish step 3 as IMGs prior to residency. There's a lot of people who wait. What is your take on completing your exams on time? How do you feel about that with the stress and rigors of residency? You are the right person to tell, like, our viewers.
Oh man, yeah, definitely. There was always like a 50-50 of like some residents telling you to take the step 3 before residency starts. Some people is like, you'll be okay, just take it like during residency. I'm definitely about taking it before residency. It definitely is so helpful to get that out of the way, because that's just an obstacle to your next chapter in life, is how I put it. Because I just grouped them together, and like now it's just like I gotta find time. Residency is busy. You work 80 hours a week, and that drains you out. It's tough to just trying to keep up with your own patient list and like kind of learn from your patients. On top of that, doing like 40 UR question a day, forget it. That's like not going to happen. And you will not retain anything. Like, you're going to be so tired that what's the point of doing questions if you're not going to be like sharp in your mind, So I definitely would recommend taking it before you are starting your residency. That is like if you matched or if you didn't match. If you didn't match, then that's actually even better, because that's going to gain you more points when you apply for residency again. But I'll probably take it right around the time after step 2. Once you can apply for step 3 and like take it, I would just get it out of the way. Because it seems from what I've been studying right now, it's like similar to step 2. There's nothing new or anything additional I'm learning from step 2 versus step 3. The only thing I could say is like the clinical skills cases, which is like doable. I don't think that will be big issue. So definitely before.
Okay. And if I have to give you a tip, when you see something on the floors, let's say you see CHF or COPD, whatever, and you were seeing plenty of these already, right? This is like Hawaii has a big diabetic population. So learn all of your insulin regimens and stuff. As soon as you see the patient, correlate, because then it sticks. But there are a lot of things that are just purely things that you have to memorize, obviously. So for step 3, like, your things that have to do with ethics. And we were talking about behavioral questions. Make sure you don't lose points on behavioral. Ethics gives a lot of foreign medical grads a lot of issues. Why do you think that is?
I think part of the reason is the foreign medical grads in general, like, we don't get, sometimes, I don't think, this doesn't come from like just Caribbean schools. I'm talking about like internationally. The big issue that we have with ethics is that every country has their own set of ethics that they go through. I think that becomes a big issue when they come to America, because we are directed towards like patient care. Our approach is completely different. And when, other students come from different countries to, apply for residency and like do these exams, they often do terrible on those tests because they are not sure about what the ethics are telling you in the American population. Because the way like I said, the lifestyle is different, the approach is different. All these little things, like, you get used to it, but it's something that really just comes with time and practice. And I would probably just say, it's definitely a good thing to read up on the American level of ethics, because it changes so much, and there's so many different rules. And one of the biggest thing about like American healthcare is like you can get sued so easily in America. And so you need to know your boundaries. If you don't, then you will definitely be chewed out by, medical lawyers, and like you'll definitely be on the judge, against the judge, and that's not something you want to be in, especially in America.
Yeah, and it's kind of scary to talk about this right now, right? Everyone's just so
absolutely.
hopeful. They want to make a difference, and everything's like, so by the way, as you know, residency applications went in a month later, and I've been literally working 24/7 to get everybody's applications out and complete, because I'm such a control freak. I look at every document, even if somebody else is helping me edit it, because I have 2 doctors per document for anything that goes out of Residency Success. This year, there'll be some changes to the interview style, like the way that we prep. We're going to have some boot camp style classes for the basics. Then we're going to have, and then behavioral questions, and then clinical questions, and then one-on-one prior to the interview. So this way, I personalize their answers prior to them going somewhere. And you would think that a lot of things are like, if you don't know the culture, it's not part of like your thinking, just like you said about the ethics, right? How to make conversation. What is important to someone that has a medical center in Hawaii versus in New York, a PD that's like every single person, there's going to be different things that are going to be important, and knowing the culture of the region and stuff, that's what my strength is, for me to personalize these things to you.
Yeah.
I think I'm blessed. Like I feel like really because of a little delay in my credentialing prior to me starting as a neurology attending, I had the time to start up Residency Success. I've helped a lot of other people match. I feel like that's really changed their lives, and hopefully that collective, like blessing will come back one day when I need a doctor, and all over the country I can call you guys,
Oh, absolutely. You definitely, you are just a phone call. We are just a phone call away for you, definitely.
Oh,
and I think
sweet.
This season of interviews is much different than it's going to be from last season. And so the biggest change is that because it's virtual, the speech pattern, what comes out of your mouth, like in terms of what are you talking about, your affect, all those things is going to be crucial. And so I think residency success is definitely going to be the most vital thing to be used by like a lot of the medical students, because it's not easy because from a screen, it's not easy to talk across from the screen, because I feel like it's all about how you bring out yourself from just the screen. That's not easy to do. If you're in real person, I think that makes a big difference, because there's a lot of things going around. You can see the tour, you can be, show your personality more to the residents and put that much into it. And this time around is much different because of the COVID, unfortunately.
Yeah, and it can be awkward, but as you see, we know each other. Okay, there's a level of comfort here. But even if, let's say, the screen went on and I was to interview you now, to me, you feel confident. Your shoulders are rolled back, you're sitting up, you're making eye contact to the screen, you're talking, you're using your hands, but not too much. Lighting is good. I would probably face the light next time, but this is not your interview. But I'm just giving people, a little bit feedback about how you should be. The comfort level and the, you feeling confident is only going to come after practicing. And so we're going to be practicing via video. So that's going to help you. So it's going to just be like another UWorld session in a way, right? Because when you do so many UWorld tests, when you're in the test, you're like, sometimes you forget, am I in UWorld or am I in a test, right? Because it's like the past sessions. Yeah. And look, just remember one thing, everybody is human beings. They just want the best for their program. They want the best for you. Because if you're not a good fit for their program, you're not going to be happy there.
Absolutely not. And so it's really hard again with the virtual process, so it's to ace an interview virtually. It's so important because everyone's doing it that way. And there's some people that are more confident, like you said, like small things matter, especially because there's not that much room to improve, to show around.
Of course. Because that's your 15 minutes of fame. you know?
Exactly. That's what it is. That's exactly what it is. It's 15
Yeah,
minutes.
you're on. Like, and I tell everybody, if you're not exhausted at the end of an interview, you haven't done enough. You should be on. You should be like, you know, using all the tactics I give you in order to make this a successful 15 minutes, you know? The other thing I remember about you is the first season, I think you interviewed and I had tried to assist you. But the second season, I remember how well prepared while I was talking to you, you were. I remember you sent me a document and I was in my fellowship in Florida at that time. And you were back in New Jersey finishing this research that we, you know, had discussed. And every single question you had sent me an email telling bullet points of the things that you might want to answer. And we sat down, I remember we made a phone call for an hour and we discussed exactly what you should say, why it's good or not. And for me, I'm a big proponent of making sure the answer fits your personality. Yeah. So for example, if you're going to say, yeah, I'm such a go-getter. I'm somebody who, like, if I see somebody coding, I'll just jump on their chest and do this confession in the middle of the hallway. But really, if they're a shy person, are they going to do that? You know what I mean? So you have to keep in mind those things and be well prepared. And that's kind of the tools that I give you, you know, like I also learn from my candidates. Like, for example, from you, learning from you, I make them do these things, make bullet points of all the answers that we discussed. So now you can even cheat, right? You can have this up like Zoom and you have like sticky notes if you forget something. Oh, yeah.
Exactly. You can have it right in front of you, which is like the best thing to do too.
Yeah, so use it to your advantage. Exactly. So that's one way. I mean, I hope nobody's watching that I can get in trouble for this, but yeah. But you know, I call them cliff notes. It's the same thing. And this will come with practice. So the sooner you start, the better it is. Next time, we're going to have Dr. Sanket come on live so that you can ask questions if you want of him, like one-on-one and direct. Tell us in 2 words or one sentence in general, how you feel the person should approach this interview season, knowing how much has changed.
In one sentence, that's a pretty hard thing to say, to be honest. This interview season, luckily the step 1 is still not pass or fail, right? I think it's still not going to be not until like next year. So that's a relief. I would say this season, interviews is going to be everything. Like the numbers will get you to the interview, but then like when you get to the interview, I personally have interviewed many of the candidates myself in my program. And, you know, you can see the different varying personalities of who's a go-getter, who's like overachiever, who's gonna like step over someone. You can totally, it's very clear cut.
It's so true.
And so it's important when you show up your personality, you gotta be yourself, but you gotta also show that you have teamwork, you have this caring capacity of, you know, taking care of patients and, you know, it's actually genuine, nothing fake. So my approach would be, when you are approaching these interviews, be yourself, but also be smart of how you're being yourself. And that's going to be the key to actually acing the interview.
Yeah, nobody wants a tattletale or someone who's going to be like annoying. Like, you want to hire somebody you want to work with.
Yeah,
right? So
absolutely.
Imagine that person looking at you and seeing what they want to see, right?
Exactly.
And,
exactly.
Yeah. So I completely 100% agree with all of the points you made. This is why you are where you are. We're very, very proud. As a Residency Success alumnus, we'll let you now relax because you came right from the hospital and you did this. Shows your commitment to helping the other students out there in the med universe. So we really thank you, Dr. Sanket. I hope this was helpful for the viewers. As I said, if you need to reach me, you know where to find me, residencysuccess2000@gmail.com. We also have a new website launching as well. There's a messenger feature where you can directly email me or send me a message. And then there's a Google Forms that's in my group that you can fill out if you would like more information.
Yeah, definitely. I would definitely recommend this program. I was like she said, I was the first person to use it, and I'm in Hawaii. I'm in the program that I wanted to be in, and so, you know, it shows there's so many success stories out there already. And so I would definitely recommend this program. And, I'm more than happy to have live questions anytime, whenever we can get a schedule set up, and hoping to talk to you guys more.
Okay, sounds good. Thank you, Dr. Sanket.
All right.